Good morning, everybody. In New South Wales to 8 p.m. last night, we had 152,000 tests done across the state, which we're very grateful for. Keep up those testing rates. We had 452 cases of community transmission, and we know that at least 50 of those would be infectious in the community, with a number of cases still under investigation. Tragically, overnight, we had the death of a female in her late 70s at Westmead Hospital who was unvaccinated, and we extend our deepest condolences to her loved ones and know what a difficult time they're going through. In relation to the suburbs of concern, obviously in Greater Sydney, southwestern and western Sydney remain the generators of most of the cases, and in particular, we want to call out the following 7 suburbs, and we ask everybody in those suburbs to be especially careful, not to leave home unless you have to, and please come forward for vaccination. Blacktown, Seven Hills, Marylands, Guildford, Auburn, Bankstown and Greenacre. In regional New South Wales, Western New South Wales remains of enormous concern around West Dubbo, Walgett and also in Bourke. And of course, there are extra supports being sent to Western New South Wales to make sure we get on top of the cases there. Can I also say that in relation to vaccinations, New South Wales continues to power ahead, and can I thank everybody for coming forward and getting vaccinated. We've hit the mark of 5.2 million jabs in New South Wales, so we're well on our way of getting to 6 million jabs by the end of August. Can I thank everybody who's come forward? That is an outstanding effort, and we now have nearly 52% of our population across the state with at least one jab. And we're really keen for everybody to look up their suburb, which is now publicly available, to see what the vaccination rate is in your suburb. We're especially keen to make sure the vaccination rate is higher and remains high in Western and Southwestern Sydney. And that is why in the next 3 weeks we will have a vaccination blitz, and Susan Pearce from Health, who has the great job of rolling out our vaccinations, will give a more detailed report. But obviously we want to see everybody between the ages of 16 and 39 in those local government areas of concern come forward for the jab. And I understand whether it's authorised workers or others, there's been several thousand bookings made already, because we know that once you get your first dose in 2 or 3 weeks' time, the chance of you getting the virus and passing it on to others is substantially reduced, and that is so critical. In addition to that cohort of authorised worker and younger people, in fact today, I can say that in the last 24 hours, 75% of our cases in New South Wales were people under 40. And that's why those extra jabs that we've received from the Commonwealth will be put straight into the arms of 16 to 39-year-olds in those local government areas of concern. That will protect them and their loved ones, but also protect anyone coming into contact with them in our workplace. And that is critical. It will also curb the infectiousness of the disease in those communities, which is so important. Can I also do a special call out for everybody across New South Wales who's over 70 years of age? The vaccination rates are okay in that age group. They're between 70 and 80% depending on the community you're in, but we want to see that higher. We want to make sure that older members of our community are protected, and so no matter where you live, no matter your circumstances, if you're over 70, please go to a New South Wales site, or if you live in the regions, contact your GP or your pharmacist or your local area health service to find out where the closest place is you can go and get a jab. I also wanted to make a few points about our vaccination strategy. Obviously, we're very keen to make sure we hit the 70% double dose and 80% double dose targets. Now, at this stage, those targets will be met at the end of October for 70% double dose and mid-November for 80% double dose. And I want to make this very, very important point, that life will be much freer than what it is today once we get to 70% and 80%. It doesn't mean we'll be completely free. It doesn't mean that we will let the virus be rampant in the community no matter our number of cases, but it will be freer than what it is today. And I really want to stress that point. We also gave an undertaking that in September and October, which will be our most difficult months, there's no doubt that September and October, until we get to that 70% double dose, the challenge for us as a team, as a government in New South Wales will be, how can we keep our citizens safe and as free as possible during those difficult months. And once we get to 6 million jabs, we will be able to consider opportunities for what we might be able to do in September and October that we can't currently do. And I want to make that very clear. Does it mean we'll be living completely freely? No. But does it mean we'll be freer than what we're living today? Absolutely. And that's why I say to everybody, please feel encouraged to get vaccinated. Please feel encouraged to make sure you respect the health orders and the lockdown. And we envisage that case numbers in the next 2 or 3 weeks will bounce around and are likely to go up substantially. And we have to brace ourselves for that. But our key aim will be keeping people out of hospital and keeping people alive. And that's why the vaccination rate obviously helps us with that. Of course, we need to see case numbers come down, and once Susan Pearce gives you the update of how many people we're jabbing in those areas of concern in the next 2 or 3 weeks, that means that 2 or 3 weeks after people have been vaccinated, they will be more protected in getting the virus, but also less likely to transmit to a high number of people. So please know that whilst we look forward to living life much more freely, where we're at with the case numbers in 70% or 80% will determine how free we are. But please know there will be extra freedoms than what we have today. And that is an absolute assurance. And once we get to 6 million jabs, we'll be calling upon Dr. Chan, who's already started to make considerations of what we can allow people to do who are vaccinated, and that's why I ask people to make sure they get vaccinated. There'll be opportunities for us to consider what things we'll be able to offer the community in September and October, which will be our most challenging months. And I just thank the community for the way in which you've responded to date. The vast majority of people are doing the right thing, and that's definitely the reaction and the feedback we're having from police on the ground. But as we know, even in other states, it only takes a handful of people on a couple of occasions to do the wrong thing, and we have setbacks. And our job through the extra police efforts is to reduce those setbacks, to make sure that we're not held back because a handful of people in a handful of situations are doing the wrong thing. So this morning now, Dr. McAnulty will give the health update. The Deputy Premier will talk about regional New South Wales. Deputy Commissioner Warboys will give a quick update on police operations. And then Susan Pearce, who's Deputy Secretary of New South Wales Health and responsible for the vaccine rollout, will talk about our ambitious plans to vaccinate nearly 600,000 people very quickly in the next couple of weeks. So I'll ask those people to come forward in a second. Thank you.
Thanks very much, Premier, and good morning. Just report on the numbers from yesterday. There were 452 locally acquired cases of COVID-19 reported in New South Wales to the 24 hours to 8 o'clock last night. There were also 2 overseas acquired cases in that period. There's a record 151,767 tests were reported yesterday compared to 156,495. So it's great that so many people are coming forward for testing if they have the mildest of symptoms or if they're contacts of cases. In terms of hospitalisation, we're continuing to see large numbers of people in hospital, currently with 447 people with COVID admitted to hospital. 69 of those are in intensive care and 24 require ventilation. This is a serious disease, including in young people. Sadly, as the Premier mentioned, we have to report a death in a woman in her 70s from Western Sydney at Westmead Hospital yesterday. We understand she was diagnosed on the 29th of July and was unvaccinated. We're continuing, in terms of epidemiology, we're continuing to see most cases in Western Sydney and southwestern Sydney. They're the suburbs we're particularly concerned about, but of course cases may spring up anywhere in the state, as we've seen. So we all need to be very alert for symptoms and get tested at the mildest of symptoms. In terms of Western New South Wales, we've seen 18 new cases to 8 o'clock last night. This brings the total number of cases in the LHD to 116. This is very concerning, and the local health district is working very hard with the community to find cases, increase testing rates, and make sure contacts are isolating and getting tested. In the Hunter, New England, we've had 10 new cases, bringing the total number of cases there to 130. We've had 1 case reported in Broken Hill overnight. This is a person who lives in the Far West Health District. The person has been infectious for some days and has been in Broken Hill and Wilcannia, Contact tracing is underway and identified contacts are being tested and isolating, and that work's continuing to identify the potential source of that infection. We've also had sewage detection in the last few days go off in test positive for fragments of the virus that causes COVID in Lennox Head sewage treatment plant. So although we have no known cases there, we're very concerned that there may be undetected cases in the community. So please come forward for testing if you've been in or live in Lennox Head, if you've got the mildest of symptoms. Thanks very much.
Good morning, and can I start by passing on my condolences to the family of the lost loved one overnight. As we've already heard, significant issues and concerns around Western New South Wales. Cases overnight, the 18 new cases in Western New South Wales, 16 were in Dubbo, 2 in Burke, and since the 8 o'clock reporting period of last night, we are also now aware of a case in Broken Hill. Our message clearly for everyone in the Western New South Wales part of the state is to go out and get tested. Any symptom, if you're not sure, get tested, because we've got to get ahead of the curve. In the Hunter New England, as we've heard, 10 new cases, 5 in Maitland, 2 in Newcastle, 3 in Lake Macquarie. Again, we are concerned, but it is improving on recent numbers. In the Central Coast, 1 new case. There is a new case in the Illawarra Shoalhaven in Shell Harbour, and the sewage surveillance in Lennox Head is of concern. What we are doing is refocusing our resources into the Central West and those areas of concern to get tested. We have a health system that is supported across the board, and of course my message to everybody in regional and rural New South Wales is to get vaccinated, to book in and get vaccinated. Don't be caught up in the AstraZeneca versus Pfizer debate. The reality is we don't have that debate when it comes to flu shots each and every year. We get our flu shot, we're not sure what that brand is, we just get on with it, and the same with the vaccine rollout. I encourage everybody to get vaccinated. I don't want to see in the future where regional communities are behind the targets set by the government because of the lacklustre approach of getting vaccinated. There are vaccinations out there. The GP network, the pharmacy network is growing each and every day in relation to vaccination, and of course our own clinics are out and about. We are focused on those vulnerable communities in Western New South Wales where we are concerned with vaccination, and again, my message to everybody, get vaccinated and help us stop the spread. Thank you.
Good morning, Premier. Good morning, everyone. 579 infringement notices issued in the last 24 hours. It is a large number, but it's just reflective of Commissioner Fuller's commitment to policing and compliance around the public health orders. The message, if it's not already there, people must really start to understand and take heed that if you are going to breach public health orders anywhere in this state, you will be caught. The time is over in terms of warnings and cautions. Policing will continue at this level, not just tomorrow, not just this week, but over the next 21 days when we have police rostered to perform the Operation Stay at Home, and we'll continue to do that right across the state, reassessing every single day at the Police Operations Centre and matching our activity to where the police should be. A couple of incidents of note. Our welfare and compliance teams, Australian Defence Force and New South Wales Police, working together on the back of contact tracing information, went to a home in southwest Sydney yesterday morning and found a person that should be there, wasn't there. They made a number of inquiries and not that long after, that person returned to the front of the house in a motor vehicle. That person was spoken to by police and ADF, was issued a penalty infringement notice, stated that he'd hopped in his car and went out for some fresh air and hadn't been anywhere else. But the point is that if you are going to behave like this, yesterday over 2,300 houses visited. If you're going to behave like this, if you're going to step outside the health orders, you will be checked on. And you will get an infringement notice, and that person will continue to be checked on and make sure that they comply. There was another incident at Villawood where ADF and police went to that home to check on the welfare of people and the fact that a gentleman in the home was actually there. After some inquiries, it was found that his pregnant wife and children were feeling unwell, and that whole family, on the back of that welfare and compliance visit, were transported by New South Wales ambulance to hospital. I would also like to indicate that yesterday, police at Newcastle, after extensive investigations in terms of a number of parties at the back end of July, have issued court attendance notices to a man and 2 young ladies, and further infringement notices for people who attended that address at Sandgate near Newcastle over the last 2 or 3 days of July. Thank you.
Thank you. It was an absolute delight to receive the news on Sunday about the increased vaccinations for New South Wales, and now the job is ahead of us to get it out there. As the Premier's mentioned, we have ramped up our clinics over the last few days to the point where we believe that we can deliver the full 530,000 doses of the Pfizer vaccine into the arms of people in the 12 LGAs in 2.5 weeks. To do this, obviously, is a mammoth effort on behalf of our districts. Can I say thank you for the work that they're doing? They've been working day and night to be able to announce this today. We are throwing absolutely everything we've got at getting those doses into arms over the next 2.5 weeks. The 12 LGAs, as you well know, it will cover people in that 16 to 39-year-old age group, a very important age group, and we know that there are several 100,000 people in those age groups, in those LGAs, who are not yet vaccinated. So that is a great opportunity for this state and also for the Greater Sydney area to get on top of the issues in those 12 LGAs. Importantly, though, we continue on with that, so that's on top of all of the other vaccinations that we will continue to give across all of our other state clinics. It's on top of the mobile outreach clinics that we're running each and every day. And just to give you an indication at the moment, the Southwestern Sydney, Western Sydney and Sydney LHDs are out there every day doing mobile clinics at mosques, for refugees, for homeless people, for people in disability centres, for Aboriginal and Torres Strait Islander groups, mental health units, the Sudanese community in various places, and obviously food groups and the Pacifica community. In addition to all of that, this week we have run 100,000 Pfizer vaccinations on top of what was already booked for authorised workers. That link was published on Saturday at lunchtime. We already have 76,000 bookings against that 100,000. I'm sure even by now it's even higher. And so I think that the long and the short of it from where we're concerned is we are throwing every single thing we've got at getting these vaccines out quickly. We're excited by the opportunity, a little daunted by it, but I've got every confidence that we can do that in that time frame. Thank you.
Dr. McAnulty, if I could ask you a question about time it takes for contact tracers. Do you have any data at the moment? We're seeing hundreds of cases a day. The average time that it takes for a contact tracer to interview someone, the time it takes for them to track down all close contacts. I know that might be kind of difficult to say in terms of absolute sense, but can you give us a rough idea of how long it's taken?
Yeah, I can take you through the process, and it's quite a complex process. We have trained interviewers and ever-expanding number of interviewers in our epidemiological team as well as in our contact tracing team, who work with cases to first of all alert them of their infection and take through with them what it means for them and what it means in terms of what they have to do to isolate, what it means for their family having to isolate, anyone else in their household and their other close contacts. Now, those interviews can take sometimes several hours to do, and we often go back to people to clarify information. So it's a complex process. It's working very closely with the people affected and their communities, and often going back several times to do that. So that process can take sometimes several hours, several days.
Okay, but how long is it taking for a contact tracer to make first contact with a positive case?
Yeah, so we aim to get everybody contacted within the day of notification. So and then we have a new system that we've introduced in the last in the last couple of days to make sure that we're, with the expanding number of cases, to make sure that we're getting people alerted to the fact that they're a case and isolating, and their families, their households isolating right away through texting information to them, as well as calling those who don't have access to texting, with a follow-up interview on aiming on the same day.
You say the aim. Sorry, just one last one.
You've seen very few close contact locations, casual contact locations in Western Sydney and South West Sydney, despite the explosion of cases. Is there a different approach now in New South Wales?
Yeah, there is. We've got a lot of experience now in from last year's epidemic and from this year's Delta epidemic of what the risk settings are for people to get transmission of infection from COVID. And so the information we have is that from talking to cases and looking at contacts and who's getting infected is that the highest risk is your household. The next highest risk is people visiting a household where there's a case. So we're still seeing people perhaps inadvertently or not realising that it's such a dangerous thing to do, visiting someone's household where there's a case. The next most concerning place for transmission is a workplace. So we're seeing, as we've reported here many times, workplaces, particularly factories, manufacturing, where you get a lot of people in the workplace, and that's why it's so important to make sure each workplace has a very good COVID safety plan. So I'll just finish the question, I'm sorry. And so we know that then there are quite low risk settings that we just don't see very much transmission at all in, and that's such as supermarkets, shopping centres and so on. So we're now deliberately prioritising in the metropolitan area venues or places where people have been in households, in other households, not their own, in workplaces, and high-risk settings such as hospitals, aged care facilities, educational settings, including childcare settings.
Of the amount of work that's involved, if you have to go into all of those locations, you're better off now just targeting those resources because the case numbers are stretching them too far. That's the reality.
So what we've learnt is where the infection is most likely to spread. We also so that's why we're focusing on those areas, and we've also learnt that people just get lost in the detail when we put up venues that just we don't think are risk factors, risk places on the website or in the media. So we're really trying to focus the public's attention on those where we believe there is a true risk.
So just to be clear, New South Wales Health has stopped putting sites on the list of potential exposure sites. You've stopped putting locations that have been visited by positive cases because there are too many locations. When did that first happen?
So we continue to play in places outside metropolitan Sydney or in areas where we haven't seen large numbers of cases, such as regional parts of the state, Newcastle, Central Coast, Wollongong. We continue to put even the tiniest risk venues on the website. In those areas in the metropolitan area where we know that there are many venues that places have gone, but very little risk for most of those venues. We are deliberately focusing on those places that I've mentioned.
And when did that happen? When did that happen?
Oh, that's begun in the last few days.
We're hearing that some of those regional businesses aren't finding out that they're an exposure site until they're listed on Facebook. Are you still aiming to call them or at least text them to tell them they need to close? So
certainly in regional areas, we're continuing to take a very solid approach in terms of identifying and working with the local venues.
Dr. McAnulty, we have an update on the hospital situation on Nepean, on St George. I understand Canterbury Hospital now has exposure sites. And are you having staffing shortages now as a result of those close contacts?
Yes, thank you. So at St George Hospital, there have been transmission 4 inpatients and 2 staff members have been identified as testing positive for COVID. There's 21 patients in the wards have been tested in isolation. No further cases have been identified to date. Sorry, I missed the rest of your question.
Yes, are there wards that are closed at Canterbury?
Yeah, there's at Canterbury Hospital there has been a ward that has been closed in light of transmission. And remember, in these places, the staff and really concerned that they're keeping patients safe, and so they're taking all the actions they can to work with patients, follow the contact tracing and health advice, and making sure that their patients are safe.
What about RPA?
Staff shortages though as a result of this now?
I can't comment on the staffing at those facilities, but throughout New South Wales Health we've got very good processes for assessing which staff are at risk and how the LHD can work together as a network to make sure that the sufficient staff are in place.
Do you have detail, Doctor?
And the Indigenous population there. Are we seeing, what number of cases do we have in the Indigenous population in Far West New South Wales and North West New South Wales, and what % of the population are vaccinated?
I can tell you, I can't give you exact numbers, but I can tell you in Western New South Wales we now have 116 cases reported to 8 o'clock last night. The majority of those have been in people who are Aboriginal. So we're working very closely with the Aboriginal community to keep them safe, to make sure that people are getting tested, and making sure that people who have been in contact with other cases are aware of that they need to isolate. And special accommodation is being set up for people to make sure they are kept safe.
Have you had to transfer any regional cases via air ambulance to Sydney yet?
I'm sorry, I don't have that information. We have to get back to you.
Dr. McAnulty, there was, I understand, 2 cases that tested positive after they went to a funeral in southwestern Sydney near Broken Hill. Do you have any more details on that? I think they left the area.
In southwest Sydney or?
Yeah, let me...
Right. There has been a funeral event in Western New South Wales, in Far Western New South Wales, that we're following up. We don't have that work is still undergoing to investigate the circumstances.
Was that in Wilcannia? Sorry? Was that Wilcannia?
I believe so.
Yeah.
Yes, it was.
It was?
Can I ask you just about the number of now outbreaks, the number of hospitals in Sydney? How concerned are you about that, and what's being done in terms of resourcing? Is there any pressure as a result?
There's absolutely no question that the hospital system is under enormous pressure across New South Wales, which is why we've had to take some measures that we've talked about in the past, so easing back on some of the less urgent elective surgery. I think if you just take a look at, say, the St George situation, that was a case where we had a long-term cancer patient who became symptomatic and was tested positive for COVID. That caused obviously further testing of patients in that ward. The person who was in the ward in the room with that particular patient was also positive. And they found another 2 cases across the ward. And there was a nurse unit manager and a junior medical officer who were also positive. The result of that, just in that one fairly small case, has taken out 80 health staff for the 14 days quarantine. So I think that's fairly indicative. I think a few days ago we were talking about the lady who became positive in the mental health ward. She was in, I've forgotten the date now, but I think it was about the 4th of August, but and a couple of days later she became febrile, had a temperature, and of course very thought disordered patients who need high levels of care with highly specialised medical staff, and that has caused pressures in that particular facility as well at Nepean Hospital. So look, it's fair to say that the health staff are doing an incredible job. I want to thank them. We're in the middle of a pandemic. That's not rocket science, and unfortunately a lot of our health staff are finding that they are on the receiving end of having to be taken offline because they are potentially exposed, not because they are exposed, but because they're potentially exposed, and some of them sadly have also been exposed. So that will continue. I just ask the community to be tolerant and understand that your nurses and your doctors and your physiotherapists and everybody else in the health system are working very hard for you, but we're in a pandemic and people will have to be taken offline, and we will have to have some inconvenience in that sense, but overall the health system is still extraordinarily good. We have 140,000 staff in the New South Wales health system. It's the biggest health system in the country. It deals with more patients than anybody else, so you'd expect that in the middle of a pandemic there would be cases that come into hospitals, and they'll continue to manage it extremely well, and I want to thank our staff. They are an amazing group of people, and every one of them deserves the very honest and complete thanks to the Minister and all of our community today.
Minister, Breastscreen New South Wales
Can
is
I go
closing.
Lucy first, then Anne? Sorry, Lucy.
Breastscreen New South Wales is closing all of its clinics, it seems, across the state as of Thursday, I think. There's a lot of concern about that. Why is that a greater risk than going to the GP and indeed, retail stores that still remain open?
Look, these are obviously health issues, and it's a matter of weighing up the relative risk to patients and staff. Last year there was a period where right across the country breastscreens were stopped for a period, and right now we're in the same situation. So the health staff who make these operational decisions have determined that's in the interest of everybody at the present time, staff and patients. But I've made it very clear to them that as soon as is possible, I would like to see that back. But on behalf of the community, I know we all want that back. But we also have a balancing act here, and I think it's not up to ministers or anybody else to tell the health staff how to manage what is a competing risks, if you like.
But does that run the risk that some
Anne,
cancers
sorry,
going to go
Alex,
unchecked?
I'll just do Anne. I said first, and I'll come back. Sorry.
Can you tell us what arrangements are in place to move people from Western New South Wales if they require intensive care treatment? Is there flights organised? Where are you taking them? How many beds are there? Can you just give us a better feeling for it?
Look, it's the same situation as per any other time, really, but with a bit of extra resources, obviously. In some of those remote communities, such as Brewarren and Wilcannia, they have very committed health staff, but when there are very urgent cases that have a need for high-level ICUs, they're generally transferred to Dubbo or to Orange or occasionally Bathurst or indeed into the city. I wrote to Minister Hunt, I think it was last Wednesday, and I asked for assistance on behalf of the New South Wales Government in regard to ADF on the ground, particularly with regard to supporting the team, our health team on the ground for vaccinations and so on. And in fact, I spoke yesterday to the person who leads the team at Walgett Aboriginal Medical Services, which is the biggest health service in, for example, Walgett, and she was indicating to me that she was really looking forward to having the support of the ADF because of the logistical needs, the structural needs to support people, and with that comes the possibility that there would be improved transference into the major centres if a patient needs it. Many patients, let's not forget, many patients don't need it. I mean, roughly about 80% of patients who get COVID can be managed at home. In fact, that's where the majority are, they're at home. But unfortunately, there are some who deteriorate very quickly, so we need to have that facility. We've got the Royal Flying Doctor Service as well. And in fact, just before this press conference, I actually rang the same person by first name, Christine, if you're there. Thank you for all the work you're doing in Walgett for all of the community there. But can I say, she also just texted me back and said that they have seen a military vehicle in Walgett, and they're looking forward to having more on the ground as soon as possible.
Deputy Commissioner, if I could.
Oh, sorry, just Alex, and then I'll move and let you have it. Alex.
Hospital admissions overnight, 50 or so extra people gone into hospital. We're hearing the situation was particularly bad again at Westmead last night. Can you give us any insight into that? Long delays for paramedics, again waiting in the car park, and they're telling us that doctors are coming out and doing their checks in the car park, effectively triaging the car park.
Look, again, in urgent times, it also happens during flu seasons. There are times when doctors who are highly capable and medical staff, our nursing staff, will come out because there might be some cases that are blocking an emergency department. That's not unusual. It happens in every system across the world. Desirably, if you had less issues happening, patients would be moved straight in, but they still get world-class care from our amazing physicians and nurses. So I don't think anybody needs to have undue concern about that, but also recognise again, we're in the middle of a pandemic. There are people coming into the hospital and putting that additional pressure on, and I just want to again thank our staff. They're doing an incredible job, and I'm sure, Alex, if you were there, you'd find in that situation you'd be extremely well looked after.
Deputy Commissioner, if I could ask you a question about the past 24 hours of fines. Thank you, Deputy Commissioner. In the past 24 hours, of those 500 or so fines that have been issued, have any $5,000 fines been issued for lying to contact tracers? And if I may ask you another one, could you...
No, one at a time, thanks.
Okay.
Thanks, Premier. I'm not aware of any fines of $5,000 for contact tracers, but it's certainly an area that we think that the fine will provide some strength to the case officers and indeed the people who are supplying the information to make sure that their memory is good and that they supply that information quickly to allow us to then get on with the process in terms of the contact tracing itself. And then on the back of that, what we will see is ADF and police going around, hopefully within 24 hours and knocking on the door, making telephone calls. Yesterday, 2,300 plus premises visited. That part of the contact tracing is going to be so important to make sure that people stay at home. And I think that whilst I'm not aware yet of any $5,000 fines, I think that is just a very strong message to people that the game is up, that when you're asked questions about this, the issue of where you've been and who you've spoken to, that you really do need to come forward with the truth in the shortest possible time.
Premier, if, as you say, September and October is going to be our most difficult months, how can you also promise freedoms in that time? And can you be a bit more specific as to what exactly you're talking about? What are the freedoms you need?
I've been asked this question a few times, as is Dr. Chant, and we've tasked her to consider if people are completely vaccinated, what low-risk activity can we provide once we get to 6 million jabs during September and October? And she is considering her advice. And I want to make that very clear. So I have always set ourselves a target of getting to 6 million jabs by the end of August, and I'm so pleased that we're going to get there with a bit of room to spare as well, fingers crossed. But that will mean that we can consider opportunities for people who are fully vaccinated in September and October, and I'll be able to convey that as soon as we get closer to that August 28th day, and as soon as we know where things are at in terms of case numbers and areas of concern. And the challenge for us is we want to make sure those opportunities are made available to as many citizens as possible. So it does depend also on what is occurring in those areas of concern. And it's really important for us to keep the community updated as soon as we know anything. But at the same time, we need to allow our health experts the right opportunities, the right time to be able to provide us that advice. So.
Case numbers, and September's only in 2 weeks.
Yeah, can I make it very clear that we are assuming that case numbers will go up. Now, I say that only as a realist, because when you have cumulative days of high case numbers, there is a tipping point where case numbers go up. But our challenge is to make sure that we keep vaccination rates up, because the more people that are vaccinated, the less likelihood of hospitalisation and the less likelihood of death. And we know the vaccines, either vaccine, have proven to be extremely useful and extremely protective against people ending up in hospital. But also, we know from the health experts that after the first dose, you get the first dose, 2 or 3 weeks after you get the first dose, you also see a reduction in how contagious you can be if you do get the virus. So we know it will have an impact on spread as well as keeping people protected. So given that we're now deploying at least 600,000 vaccines through a targeted approach in those areas of concern, that we will have in 2 or 3 weeks' time a much greater proportion of the population who are protected against spreading the virus further, but also protected against hospitalisation. And the key challenge for us is getting to as many of those hundreds of thousands of authorised workers as quickly as possible between the ages of 16 to 39, because we know that is the age group from those areas of concern that are going out and doing those essential jobs that all of us rely on, doing those essential jobs which keep food on the table and keep services that we need happening. And as soon as we can get all of them protected, the results will be indicated in terms of reducing the spread, but also reducing hospitalisation. So all of these factors are taken into account. But I do want to stress that once we get to 6 million, it does give us options as to what we can consider in the months of September and October, and obviously by the end of October we will get to 70% of double doses, which gives us more options about what we can do. So whilst there will not be complete freedom at 70% or even 80% depending on the case numbers, life will be much freer than what it is today, and that's the point I want to make. Because even countries around the world with 80% double dose vaccination still rely on QR codes, mask wearing in certain settings. So we know that whilst the Delta variant in particular is very active around the world, there'll always be a level of protection we need to have, but life will be much freer than what it is today, and that is the key point. That we won't have to live with the harsh restrictions that we're living with today. But that's why today and in the last few weeks we've done a call out not just to people in those areas of concern to get vaccinated, but especially our older citizens. If you're over 70 anywhere in the state, please do not hesitate to get the vaccine, because that will protect you into the future. So even if you're not worried about it today, when we're at 80% and the community is freer than what we are today, that does increase the risk for people who aren't vaccinated. People who aren't vaccinated will have a greater risk of ending up in hospital or dying. We don't want to see any of that happen. That's why in particular we're saying if you're over 70, and the vaccination rates have gone up substantially in those age groups, but if you're over 70 anywhere in the state, and the Deputy Premier made the same point for our regions, your region, your city may not have had a single case during the entire length of the pandemic, but please know down the track in the months ahead, when we get those higher rates of vaccination, we start opening up, people who aren't vaccinated will have a higher risk, and we don't want to see anybody who's vulnerable susceptible to any risk. We want to make sure that people are protected as much as possible.
If you're saying that the cases are going to go up in the current settings with the current restrictions over the next 2 weeks, that's what you said, you think that the case numbers will go up. How can you then take the foot off the brake, even for people who are vaccinated? We know that vaccines don't stop fully the spread. So you're saying case numbers are going to go up in the current settings, you're willing to see case numbers go up even further if you take the foot off the brake.
But we know even now, even during a strict lockdown, any community anywhere in the world, even during a strict lockdown, whether it's New South Wales or any other state, still allows citizens to do certain activity. In New South Wales, some of those activities...
The case numbers going up has massive ramifications for people.
Can you please let me finish my question?
The case numbers going up, if it reaches over 500, it has ramifications for people in the rest of the country. So are we willing to let that happen?
As I've said, and I'll say again, when you get to a point where a particular proportion of the community is vaccinated, there are considerations for fully vaccinated people to undertake low-risk activity, which other states around the world with similar situations to New South Wales, or far worse situations than New South Wales, are already doing. So we are looking at, I am not about to make any decision, or I should say the New South Wales government is not about to make any decision which is going to either impact our case numbers or else risk human life. That is not what the New South Wales government does. But is it our job to look at how we can allow the community to live as safe as possible and provide an extra freedom? Of course that's our job. I would never expect anybody to suggest that we should sit on our hands and just let people live the current way for the next couple of months. We always have to challenge ourselves. We have to make sure that they're educated decisions based on the health advice. But if there are low-risk activities which can be identified in September and October, we'll provide those opportunities. But having said that, please know we are putting our foot down in terms of reducing the case numbers. That is critical. But the reality is, given the number of cases we've seen in recent days, I would not be surprised if those case numbers continue. That is not the trajectory we want for New South Wales. But we also have to be real about what is likely to be around the corner. But we also have to know that vaccinations are a good way to keep us safe and out of hospital, and to make sure our loved ones are protected.
We have the toughest restrictions in Australia and Greater Sydney.
Oh, look, you have to look at all of the settings in total. But if you look at the length of our lockdown and the restrictions we have in place, it is a combination.
Masks outdoors, playgrounds closed.
It is a combination. It is a combination of things, and even during the harshest time of the Victorian lockdown last year, citizens were still able to do some things they can't do in New South Wales. So you have to look at the total package of lockdown and strict lockdown conditions. There are still things. There are still things we can't. There are still things we can't do, and as we know, dealing with Delta through a short, sharp lockdown doesn't necessarily work either. So we have to be real about that. The Delta variant is like nothing we've seen. And we all have to be real about that. Sorry?
Could I ask you about regional permits? In Saturday's press conference, you said the technology was there for Service New South Wales to roll out the permit system to cover the regional areas. If that's the case, why are applications only opening at the end of the week when the permit system starts on Saturday, and how long will it take to process?
Yeah, no, we made very clear the day we announced those extra measures that the permit system would be, the actual permits would be issued from Saturday. But please know the police officers, police force can still book someone based on the information they have. The permit system simply makes it more efficient and takes less time for police officers to get to the bottom of a case. When police pull you over, or confront you, they will know when you're doing the wrong thing. But it will take them less time if there is a permit in someone's hand to be able to say that that person is travelling legally. And that comes into place from Saturday. But until that time, make no mistake, the police have the ability to fine you those substantial fines or worse. But obviously it may take them longer. But the permit system, which comes into effect from Saturday, gives them the opportunity to do it more efficiently and quickly.
Premier, the LGAs of concern, the dozen LGAs of concern, can you confirm there is going to be some adjustment there with the 5K rule, that people who are going shopping or exercising in those LGAs cannot go into the next LGA that they're bordering on?
Well, no. In those areas of local concern, there is a flat rule of a 5-kilometre radius from your house. So you're not supposed to go anywhere beyond that 5 kilometres.
Can you go into the next LGA?
Well, it depends. You might live right on the border, right? So if you live right on the border, that's why it's a simple rule in those local government areas of concern. You're not supposed to go anywhere outside of a 5-kilometre radius of your home, irrespective of the local government area, because obviously if you live right on the edge of the street to the boundary, that limits your opportunities to go perhaps to your closest shop might be 100 metres away, but in a different LGA. And that's why we've made that rule, to make it clear. If you're in an area of concern, you shouldn't be doing anything outside of, well, firstly, you shouldn't be leaving your house. But secondly, if you do need to leave your house for an essential purchase, you should do it within 5 kilometres. If you're doing exercise, it should be within 5 kilometres. And obviously, we only want you to leave home if you have to for work purposes or for vaccination.
On the thresholds, Premier, if we're easing restrictions when we get to 70 to 80%, how are you going to manage the risk to regional and rural New South Wales? Will that 70 to 80% threshold, will that be a statewide total that when Sydney gets to 70 to 80%, the whole state will start opening up, or will Sydney start opening up when regional and rural New South Wales will still be locked down because they will not be anywhere near 70 to 80% double dose?
Well, these are the challenges that the New South Wales government has to consider moving forward, and that's why we're encouraging, firstly, people in areas of concern to make sure they take the opportunity to get vaccinated. And as the Deputy Premier said today, we don't want to see any rural and regional communities who may not have felt the need to get vaccinated until this point in time have lower rates of vaccination than the rest of the state. So ideally, you want those high levels of vaccination to be equal across all the state, but we're confident we can get there.
So
we're confident that the people of the state will come forward to get vaccinated, but we don't want to see any community left behind. And ideally, given the concentrated effort in those targeted areas of concern, we'd love to see those vaccination rates go even higher than 80%. So it's really important for us to not only target the areas of concern, but also to make sure that there isn't any part of our state which has lower rates of vaccination than the average, because that will ensure safety. It will also ensure that particularly vulnerable communities will be protected once we get to a stage where people have greater freedom. Because once you start opening up, when you get to the 70% or the 80% double dose, people who are unvaccinated will be exposed, and we don't want to see anybody unnecessarily go to hospital or worse. So we are really working towards getting increasing rates of vaccination as quickly as we can across the entire state, and increasing the availability, the points of access for people to come forward.
Specifically, Premier, will Sydney need to wait until regional and rural New South Wales get to 70 to 80% double dosed, or will the whole state start opening up when the whole state's population gets a 70 to 80% double dosed, even considering the fact that that will mean some remote communities aren't vaccinated at all?
Well, these are the difficult public policy decisions our government will need to take as we get closer to those targets. But that's why we have, and can I again thank Susan Pearce and her team, we don't do it enough, but they are working around the clock to get jabs in arms across the length and breadth of our state. And points of access, as the Deputy Premier would know, points of access in rural and regional communities are sometimes more challenging because your GP may live a considerable distance away from your home, your closest health site might be further from home, but we're making sure as much as possible that people have access to the vaccine, that they can confidently take it, and make sure that we get those rates up in every part of our state. And there is now the ability to look at the vaccination rates by postcode through the New South Wales Health website and through Service New South Wales. So now you'll be able to look up your postcode to see how the rates of vaccination are in your community. But obviously, we will be safer if we have those high rates of vaccination universal across the state. We know that's not the case yet. And just to give you an example, in some parts of Western and Southwestern Sydney, we only had vaccination rates of first dose at around 19%. In some of those same communities, first dose vaccinations are now in their late 40s. So in the last 3 weeks, there has been an incredible jump, and I'm so heartened by that because it means there's an extra layer of protection, but also we can see or start to see, not yet, but in 2 or 3 weeks' time, a further reduction in the spread once those jabs take effect. It does take time.
Can I just ask again about schools? Is it realistic that they will go back this term? It seems not. And if that's the case, can you tell people now and perhaps give us an idea of when you'll be able to outline a roadmap? I realise it's really hard because they're not vaccinated.
Yeah, we are still working on the roadmap to schools and what education looks like in fourth term and third term. But that is why we're planning ahead in vaccinating, obviously as a starting point in the areas of concern, all the HSC students. We made that decision knowing that we want HSC students to be able to sit for their examinations, which is a requirement for them to attain the HSC. So we're very keen to make sure, firstly in the areas of concern and more broadly, that everybody feels safe when they're sitting for their HSC exams. And we're also looking at opportunities obviously in September and October for vaccinations amongst broader numbers of students who are eligible to take the vaccine. So that is a strategy in hand. Health and Education and other government agencies are working very closely as to what school can look like and might look like. And we know that parents want certainty, as do I. One of the things that causes me the most stress, and I have to say this honestly, one of the things that causes me most stress is the stress that I know households go through when they're homeschooling. And we want to provide that certainty. But we also know parents are stressed about the safety of their children. Unfortunately, Delta is impacting young people unlike other strains. Young people aren't spreading it, not necessarily getting it in high numbers, but obviously we want to make sure that children are protected. And that is why we have to have a school safety plan that addresses those concerns, but also the health needs of younger people during what is a particularly nasty strain of the virus.
$87 million in business grants, Premier. In business grants, Premier.
Blow yesterday for many people to hear that 80% vaccination is probably not the ticket to freedom. Can you give them anything to cling to today about what much freer means? In November, will we be sitting at restaurants? Will we be seeing our family?
I was a bit more concerned, about some of the commentary around the comments yesterday. 80% double dose means we can be freer than what we are today, no doubt about it. But does it mean we forget QR codes? Absolutely not. Does it mean particular events will require double dose vaccination? No. So we are working on a plan now as to what life will look like at 80%, and it does depend on the case numbers at the time as well. It doesn't mean that we'll be living the way we are now. We'll be living life a bit freer, but the level of freedom will depend on the case numbers at the time. In some countries, which is not the strategy of the National Cabinet or the New South Wales Government, in some countries, once they get to a particular rate of vaccination, they don't care. They just say you have complete freedom, don't check in, don't do anything else, and then they see thousands of people with the virus. We're not about that. We're about making sure that when we hit those vaccination targets, we're considering the safety of our citizens, we're considering what restrictions still need to be in place to protect people who aren't vaccinated. But will life be much freer at 80% double dose than what it is today? Absolutely. But we don't know exactly what that looks like until we're closer to that time. And at the moment, we get to 70% double dose at the end of October. We get to 80% double dose in mid-November. But the extent of what we can do is dependent on rates of vaccination, obviously, but also where the case numbers are at. And ideally, we need to see them much lower than where they are now if we want to live life freely prior to the outbreak.
Deputy Commissioner.
Last question.
There's
Sorry.
$687 million in business grants, Premier.
I'm sorry?
$687 million in business grants that still haven't been paid. Will that $687 million be paid to businesses who have applied by the end of the week? Will that be cleared?
Yeah, I'm pleased to say that the wait times are now down to 10 minutes on average for businesses applying.
That's just for the call centre when people call to ask where their money is.
Yeah, please. I was about to get to that. So obviously we're pleased that the wait times have reduced, and on average, businesses are receiving the money in their bank accounts within 4 or 5 days of making their application. So we again apologise for any frustrations or delays that were experienced. I understand there's nearly $1 billion that's gone out the door in terms of business support, but also please know that irrespective of where you live in your circumstances, that there is help and support for you as an individual through disaster payments through Service Australia, and of course through Service New South Wales for business grants. So we've reduced the wait time substantially. The last report I had told me the average wait time was 10 minutes, but also in relation to getting the money in your bank account, the average day is 4 to 5 days after application.
Deputy Commissioner.
Could I ask about vaccine incentives really fast? You promised that. Could I ask very quickly about
last
vaccine
question
incentives?
for me,
Sorry,
and then Deputy Commissioner, and then that's it. Sorry.
You had mentioned that.
I'm sorry.
You had mentioned that that you were looking at vaccine incentives, like things like the Die and Discover. Where is that at?
Yeah, that's why I'm urging everybody to get vaccinated. If you want to get back to work, and if you would like to attain a service that you currently don't get to do, we're encouraging everybody to get vaccinated, because full vaccination will give us opportunities to provide individuals during September and October. That is what we're considering, and that will depend on the health advice. But having said that, I just don't want anyone to be under any illusion that we desperately need to get those case numbers down. So yes, there are opportunities for greater opportunities for freedoms once we hit our vaccination targets, but they will be limited if case numbers are to remain too high. We need to get the case numbers down as much as possible to allow us to consider greater options and opportunities. And I think people understand that. It's obviously the higher rates of vaccination and the lower the case numbers, the more opportunities we have to give people safe options. And that's what I want people to consider in the next few weeks. Deputy Commissioner will answer the final question, and then we'll be back here tomorrow at 11 o'clock.
Deputy Commissioner, just very quickly, we know that household transmission is really the biggest concern at the moment, and we've got an increasing problem of people going to other people's houses where they shouldn't be. How is your operation actually targeting that, though? Because we know that police aren't randomly door-knocking houses. They're only going to close contacts. So have police actually given out any fines to people for being in someone else's home without reason?
Yeah. The Commissioner's Operation Stay at Home is applicable and has been wound out to every police district, every police area command, every specialist area. The Police Operations Centre is open 24/7, every single day, tasking and deploying police to places where they best need to be. So in terms of the household, the hundreds of tickets were issued yesterday, 579, but of that there were well over 100 tickets issued to people for being outside their house without a reasonable excuse. And that continues.
In someone else's house, though?
That continues to be a trend where what we would say is that people who are outside their house without a reasonable excuse, one of the only things that you can factor out of that is they're going to visit someone. So police certainly are doing plenty of door knocks in terms of those people that should be in their home isolated or quarantined in their home. But the mere fact that the presence and the visibility of police right across New South Wales, stopping and propping people, whether they're in a car, whether they're walking down the street, I think sends a really clear message to people that if you want to step outside the public health orders, you will get caught.
Thank you. Thanks, everybody.